So what if you could calm down your anxiety, get some real relief from chronic pain, and maybe even boost your memory? All with just the push of a button? I'm not talking about some new drug or a complicated surgery. Today, we're going to dive into how scientists are literally hacking into the body's master nerve to tackle some of our most stubborn health problems. And to really get why this is such a big deal, let's just start with one number: $44 billion. That's how much major depression costs in lost productivity every single year, just in the US. It's a staggering problem, and it's only one of many conditions that, don't always get better with the usual treatments, leaving millions of people just desperate for answers.
So, here's the question. What if the answer isn't another pill with a giant list of side effects? What if we could actually treat these issues by, speaking the body's own language, its own electrical language, directly through one single nerve? That's the revolutionary idea we're digging into, a completely new angle for problems that have had doctors scratching their heads for decades.
First, let's just take a second to appreciate the sheer scale of this challenge. We are talking about conditions that are famously and frustratingly resistant to treatment.
Yeah, we're talking about things like major depression, PTSD, relentless chronic pain, those migraines that just completely derail your life, and even types of epilepsy that just won't respond to medication. For anyone living with these, it is so much more than a diagnosis on a chart. It's a daily, exhausting battle. And that's exactly why finding a new kind of solution is so incredibly important.
So, what is the key to this whole new approach? Well, it turns out it's the body's own information superhighway. This one single amazing nerve that links your brain to pretty much every major organ you have.
It's called the vagus nerve, and you have to think of it less like a one-way street and more like a constant two-way conversation. It's sending these calming signals from your brain down to your heart, your gut, you name it. And at the same time, it's sending these critical status updates like, hey, I'm stressed out, or everything's cool, feeling calm, from your body right back up to your brain. This whole feedback loop is absolutely essential for keeping everything in balance. Okay, so here is the breakthrough. What if you could hack into that conversation? Well, scientists figured out a way to send their own therapeutic signals down this superhighway. And this is the really crucial part. They found a way to do it without making a single cut. You see, for years, the only way to do this was to implant a device, kind of like a pacemaker, right in your chest. That meant surgery with all the risks that come with it. But the real game changer is what we call non-invasive vagus nerve stimulation, or nVNS. It's this simple handheld device that basically puts this incredibly powerful therapy right into a person's own hands, safely and easily. And the process itself is honestly so simple. A person just takes this little device, places it on the skin of their neck or their ear, right where a branch of the vagus nerve runs close to the surface. It then sends this mild electrical pulse that you can barely even feel. That little signal zips up the nerve and into the brainstem, where it basically acts like a tuning knob, helping to dial down all those overactive circuits that cause things like pain, stress, and inflammation.
Okay, so the idea is fascinating, right? It sounds almost too good to be true. But the big question is, does it actually work? Let's take a look at the evidence.
Let's start with chronic pain. A huge review in 2024 looked at the results from 15 different studies and found a clear, statistically significant effect.
So what does that mean in plain English?
It means that stimulating the vagus nerve right through the skin, what they call transcutaneous VNS, really did reduce people's pain levels. For a therapy that doesn't involve any opioids, that's a massive deal. And how about stress? Well, another 2024 trial looked at stimulating the nerve through the ear. The group that got the real active stimulation, they saw a significant drop in their stress levels. And the other group, who got a fake or sham stimulation, well, they saw no real change at all. The results couldn't be clearer.
Now, for the millions of people who get migraines, the data here is also really promising. A major clinical trial discovered that patients using an nVNS device had, on average, almost one entire headache-free day more per month compared to the placebo group. Now, that might not sound like a ton, but if you suffer from chronic migraines, getting one day of your life back every month, that is a huge win.
And it just keeps going. The research is absolutely exploding. Studies are showing it can cut down seizure frequency in epilepsy. It's demonstrating real antidepressant effects. Pair it with physical therapy, and it can help stroke patients regain movement. It's even been shown to improve cognitive function. I mean, the sheer variety of these positive findings is just incredible.
So what's the big picture here?
What's the main takeaway? This isn't just some cool new gadget for headaches or a niche therapy for epilepsy. No, this technology represents a whole new platform for medicine. It's a way to treat a massive range of disorders by working with the body's own natural wiring, not fighting against it.
And the frontier just keeps expanding. We know the vagus nerve is like the body's master regulator for inflammation. So could it treat autoimmune diseases like rheumatoid arthritis? You bet. Researchers are testing it. Could it help protect the brain in diseases like Parkinson's and Alzheimer's? Early studies are already happening. This could completely change our entire approach to some of the toughest diseases out there.
And all of this leads to one final, fascinating question. We are moving into the age of bioelectronic medicine, where we treat diseases with targeted electrical signals instead of just chemicals and drugs. So, in the very near future, could your doctor's prescription not be for a pill, but for a handheld device that lets you literally reset your own nervous system? It's a powerful idea, and you know what? That future might be a lot closer than any of us think.